So one of the new exciting things that's happened with lung cancer screening is that they have changed some of the guidelines, which I think has increased access to screening, which is good. Increased access to screening means the potential to save more lives from lung cancer deaths. So it used to be that you had to have accumulated a 30-pack year smoking history. That means 1 pack per day for 30 years or 1/2 pack per day for 60 years. So they've dropped the requirement for dose from 30-pack years to 20-pack years, so you don't have to have smoked as much. They've lengthened the age entry. So the age entry used to be 55 years old to 75 years old or 78 years old, depending upon what the insurer was. Now they've changed that from 50 years old to 80 years old. So again, younger people are now eligible and older people are now eligible. And the latest component that is has been changed by the American Cancer Society is the rule which said that if you had quit smoking more than 15 years ago, you were not eligible for screening. And what that did is that barred a lot of ex-smokers who clearly had increased risk for lung cancer from being screened. And so the American Cancer Society has done research and issued meta-analyses that's clearly shown that having quit smoking for 15 years does not alleviate your risk of lung cancer. And I fully endorse that because your risk of developing lung cancer doesn't go away. And we've diagnosed plenty of lung cancer in people who quit smoking well over 15 years ago. People at risk for lung cancer who were screened with CAT scans had significantly fewer lung cancer deaths than people who were screened with chest x-rays. In addition, which is even more exciting, and we've seen this with our own experience here with our lung nodule program, when lung cancer is diagnosed during screening with low-dose CT, it's being diagnosed at an earlier curable stage. So the majority of cancers that are picked up when you screen with CAT scan are stage 1 and stage 2 cancers that are cured. And because we have a lung nodule program, it's beautiful because if their low-dose CT shows something that's concerning, that's brought to my attention, and then I refer that patient to our lung nodule program where they're seen within a week or two so they can get prompt evaluation for something that could potentially turn out to be lung cancer. I just want people who are at risk for lung cancer to feel comfortable to step forward and get screened. It's really, lung cancer screening has been available since 2013, 10 years. And yet when you look at the percentage of the population who's being screened, who meet criteria for screening, it's 6%. That's appalling. 6% of people who are eligible for screening are being screened. So I guess what I want to say is we're here, we want to reach you. We want to offer you screening and potentially save a lung cancer death.